My name is Jessica and I'm 29 years old from California. I recently had a breast reduction consultation with Dr. Motykie when I met him on the doctor's TV show.
I think about my breasts every day and just wish that they were smaller so that I could feel normal. My chest is a 36G. Recently I lost 30 pounds and not a single inch or even centimeter was removed from my breast.
I'm looking forward to being able to go back to my gym and do over and above what I've been able to do in the past because of having large breasts. For as long as I can remember, and I'll just say 10 years, I've wanted a breast reduction for the pain, the discomfort, the fact that I can't have an active lifestyle, and everybody always staring at me.
If she decides to want to do the surgery, I'm going to be willing to do it for you.
Thank you.
Okay? So if you want to do it, you're welcome. Hello.
Hello.
Well, how you doing?
I'm good. Okay.
Yeah. You
Hi.
doing all right?
Yeah.
You lose any more weight? You stable? Where are you at?
I'm like 3 pounds from my max goal weight. Last time I checked.
You're 3 pounds from your goal?
My max goal weight.
Well, how much did you lose altogether?
I think since the first time I met you, probably 20 pounds.
Oh, that's pretty good.
I didn't even see the 10s.
That's impressive. Questions about the surgery at all?
Not really. Just
Yeah.
to make me pretty.
Well, we talked about a
think-
couple different things. What size you want to be? Did you shrink at all?
I think I'm floppier.
You think you lost a little bit?
I just feel floppier.
Well, like when they come down a little bit, that's how they feel. So
Yeah.
maybe you lost a little volume.
And then you said that you were going to try and get rid of the scar from the mole that I had?
We're gonna try, but what we're not gonna do is let it ruin any part of the other operation. So in other words, I'm gonna do the markings now, and if we can get it to fall into into the areas where we can take some of the skin out, we will. But we don't want to jeopardize the shaping of the breast for the scar. You can always take the scar out later if we want to, but we don't want to chance it. The surgery itself is really 2 parts. The first part I call is the reduction part. We actually remove some of the breast tissue. The second part is actually a lifting part of the procedure, or reshaping of the breast. So once we remove the tissue, we want to reshape it into a breast that's more youthful and also perkier, because there's really 2 problems, right? They're low and they're heavy, so we want to correct both those problems. What's your number 1, 2, 3 things you want to accomplish from the surgery?
I don't want my areolas to be pointing up.
Bottom.
Some people do that. I don't like that. I still want them to be like parallel, normal looking. Like, to me, normal is like parallel.
Okay. What else? What's number 2 and 3?
Obviously smaller.
Okay.
And just to look my age.
If nobody knew you had this surgery, you know that after a while, as the scars fade away, that it shouldn't be embarrassing for you at all. They just look like breasts.
Okay.
Okay, just smaller, perkier version of what you have.
Average size of a woman is CAD, right?
Everybody's different. Height, weight, change, body type. For you, I think with it's going to be a big reduction either way we go. So if we overdo it, I think you're going to be unhappy.
Listen.
Hold on, let me see if they're ready for you. They got a little patch on. Everything else is
Yes.
on. Any questions about anything? Surgeries? Nothing. Everything's ready to go. Let's get this let's get it done. All right, hold on. Hey.
Seems awesome.
It's time. After examining Jessica, I think she's a great candidate for breast reduction. I think there's a couple of things we talked about as far as her doing her part and me doing my part. I think one of the things we talked about is a little bit of weight reduction or weight loss, because the breasts are made majority of fat. So sometimes with a little bit of weight loss, the breasts tend to shrink. What we don't want to do is overshoot. We don't want to do the surgery and then have her lose weight because the breasts might be too small after the surgery.
Every single patient I have ever had, every woman I've ever met who has had a breast reduction at any age says the same thing. I wish I had done it earlier. It changed my life for the better. It's your body, it's your decision.
You never know what to expect when you're going in and you're just putting your life in someone's hands, but I trusted him before and I've never met somebody so kind and generous. Literally since the night of my surgery, I remember sitting in the hotel room and was just like, I have no pain. I have no pain, and I just had come out of surgery. I've never had back pain since then, never again from having a large chest. I waited 10 years to get a consultation and get this done, and I lost 10 years of my life. Having this procedure done to me has made me a different person. I know that I'm a lot happier. I feel better about myself. I like myself now.